Welcome to the DoubleACS Daily News for July 8th, 2016. Every summer, communities across the nation have to find ways to minimize the spread of mosquito-borne diseases. The Attleboro Health Department recently teamed up with the Bristol-Norfolk Medical Reserve Corps to hold a mosquito control information session at the Attleboro Public Library. Entomologist Priscilla Matton led the presentation, and we spoke with her to find out more about it.
Tonight at the Attleboro Library, we did a little presentation about the services that Bristol County Mosquito Control offers to the residents of Bristol County, and some of the things that you can do to help prevent mosquitoes either right around your own yard or preventing them from biting you. One of the biggest issues that we have is bats. So certainly bats will eat mosquitoes, but the idea that bats will eat 5,000 mosquitoes in an evening or 1,000 mosquitoes in an evening. Certainly, I encourage anybody that wants to put up a bat house, anybody that wants to encourage dragonflies to be around the area, any natural way to help control mosquitoes, but just to be cautious that certainly bats, birds, and other animals are not going to be the only way to help reduce mosquitoes. Another misconception is just repellent. It doesn't last for very long. Usually about 30% DEET will give you about 4 hours worth of protection. But if you're going to be out there for a long time, you're going to need to reapply. If you're using sunscreen and a repellent at the same time, then you definitely want to make sure that you put your sunscreen on first and then make your application of your repellent. Reapply both of them as well. And to remember that repellents are going to keep the mosquitoes kind of away, but not totally away. So mosquitoes still may land on you. Repellents don't keep them quite that far away. So just because they're around doesn't mean that the repellent's not working. Just some of us prefer to have them a little bit further away than buzzing around our heads. Mosquitoes breed in little pockets of water, those buckets, kiddie pools, dog dishes, gutters that you may have. And any time you can do anything to reduce any of that water will help reduce the amount of mosquitoes you have around your yard. Mosquitoes lay their eggs either directly on top of water, which can't dry down, or a certain amount of our mosquitoes lay eggs right along the edge of the water, and those mosquitoes actually have to dry down. So they go dormant for a period of time, and then when they come in contact with water, usually through rain events, they will hatch. Some mosquito eggs won't hatch for years. They'll just lay dormant in the soil or in that bucket that you have, that black ring around your bucket that you think might just be dirt could actually be mosquito eggs. And as soon as they come in contact with water, if the water's warm enough, then usually within about 20 minutes you'll start to get a hatch. But those mosquito eggs can last for quite a long time. None of the pesticides that are available actually control eggs, so it's not something that we can do a whole lot about, but certainly if you're checking your bird baths and checking your containers, if just swiping away that dirt line can also help reduce those mosquitoes. If you get bitten by a mosquito and you're concerned, certainly always see your doctor. So for West Nile virus, which is pretty common here in Massachusetts, a lot of people will be asymptomatic. They'll have no evidence. Other people will have flu-like symptoms is what it tends to be. Headaches, joint pain, muscle aches. We're finding more and more as West Nile virus is here in Massachusetts and has been since 2001 that some cases are diagnosed right at the doctor's office. Some are diagnosed through blood donations. So not everybody is getting sick. Eastern equine encephalitis, EEE, tends to be more severe. Usually if you have EEE, people know about it. You'll get fever, you'll get stiff necks, you'll get joint pain, you'll get swelling of your spinal cord, and it tends to be much more severe than West Nile virus is. Now, if you're traveling, definitely check the websites for CDC or even the Mass Department of Public Health and look for any travel advisories that may have for your locations. So if you come back from a trip and you've been bitten by mosquitoes and you're not feeling well, you'll definitely want to let your physicians know that you may have been exposed to something like Zika, dengue, chikungunya. All of them are circulating right now in the Caribbean and Central and South America.
That's it for today's update. For DoubleACS News, I'm Austin Ricketts.